All right, so the study itself goes like this. You have two twins, they're identical twins, and at the time of study publication, they are 44. However, they were tracked since age 25. So the study spans essentially approximately 20 years. And the idea is that twin A had been getting these injections cosmetically since age 25, every 3 to 6 months. The protocol was pretty standard, and it involves her frontalis region, the forehead, the glabellar region with the procerus and corrugators, and the crow's feet. And the number of units is also pretty standard. They used about 20 to 30 units per each of these regions. At the time of publication, the twins are 44, and the authors essentially found that the twin sister who had been getting these preventative injections since age 25 looks significantly better than her sister. And that includes both the static and the dynamic facial lines. In other words, both during rest and also during dynamic facial motion, so like smiling. What's interesting is that they also found that the skin quality itself was actually better in the twin sister who had been getting these injections preventatively. Now, these results are not really shocking given the mechanism of action of Botox, because Botox works by paralyzing muscles. So by decreasing the release of the acetylcholine and the neuromuscular junction, it basically leads to paralysis of that part of the muscle. And when that happens, you're gonna be less prone to developing the wrinkles, which form because of the repetitive muscular motion in that region. So again, they're not shocking. Perhaps what's a little bit surprising is that the skin quality itself is better, and that suggests that there's some kind of skin remodeling that happened at the epidermal or dermal layers that is beyond what one would expect from simply the mechanism of action of Botox itself. One interesting caveat to the study is that the two twin sisters live in very different parts of the world right now. So twin A, the one who had been getting the preventative injection since age 25, actually lives in Los Angeles, and twin B lives in Munich, Germany. Now, the UV index is very different, obviously. It's much higher in LA than it is in Munich. So one would expect that the twin A would be at a disadvantage. But because she had been getting these Botox injections preventatively, she was ultimately the one who looks significantly better than her sister. And the authors controlled for other parameters in the study, so they made sure that they both have office jobs, they are using the same sunscreen, neither one of them had any kind of cosmetic surgery, things of that sort. All right, that's basically it. I honestly find it surprising that not more people talk about this study, because it really changes the way you think about the Botox timing. Most people end up getting their Botox injections cosmetically after the wrinkles have formed, so usually in their 50s, maybe in their 40s. But based on the results of the study, it sounds like it might be a better idea to get them started earlier on to prevent the wrinkles from happening in the first place. Let me know what you think in the comments below, and don't forget to hit the like and subscribe buttons. Thanks again for your attention.